dans les cieux et sur la terre. Il est au cœur non plus d'eau, au cœur que l'on condamne. Jésus est plus grand pour moi.
Là que yon moun apote, yon maman apote yon petit, li gen pile faculté là-dedans. Li pas capable manger bien, li ben pour problème, on bâti votre fait mal. Oui, c'est parce que me battais jeune soeur, l'aime devine jeune soeur, me devine état, me devait dire tous les deux. Mon père jumelle, me dit tous les deux.
MamaBaby Haiti is located just a few minutes outside of Cap-Haitian. The mission of MamaBaby Haiti is to decrease the maternal and infant mortality rate.
MamaBaby Haiti opened November 1st, 2010.
We are the only freestanding birth center located on the north end of the island. Women travel from many, many hundreds of miles to come and have their babies here with us and get prenatal care.
It was hard when we first started. The plan was to improve maternity, death, and infant in Haiti.
Women die at a high rate here from childbirth-related complications. Newborns die at a high rate from infection, lack of immunizations, and we're trying to diminish that.
We met different cases where if the mom had better care, they won't die in the birth. That was the aim. They start the clinic.
Dimona, Stephanie.
When a mom comes in for prenatal care, generally what will happen is she's assigned to a midwife. We take a medical history from her. Then she goes on to a prenatal visit.
Besides the prenatal care the moms get, the education is very important too.
One of our goals here at the clinic is to help women understand that they have choices. When you're not educated about certain things that happen in pregnancy and you don't know the signs and symptoms, then it's much more difficult to know when to seek treatment. When they're given education, they can begin to understand some of the complications that occur with childbirth and pregnancy, and they can do something about it.
Mathieu, Roselyn.
When women come in, we give them a medical record card. It's just a card that has their medical health history on it. So one of the things that we have seen is women get a sense of empowerment from that. It's their medical record. They're responsible for keeping up with it. They're responsible for bringing it to every visit so that the midwife can record their prenatal visit in there.
No.
Has she ever heard of cervical cancer?
No.
Our information tells us that Haiti has the highest reported incidence of cervical cancer in the world. Yet when we sit down and talk to women and ask them, do you know what cervical cancer is? Do you know how you get it? Do you know how it's treated? Their answer is no. And it's that lack of education that is leading to the deaths of women. MamaBaby Haiti's original mission was to reduce the maternal and infant mortality rate. We quickly realized that there are more issues in Haiti than just this. Cervical cancer is a huge problem here. Women are not being tested and treated for sexually transmitted diseases as frequently as they should. They're not receiving medications for those diseases. They're not receiving pap smears, breast exams. And so the Well Women in Northern Haiti program is going to provide sexually transmitted disease education, testing and treatment, family planning, and then they'll decide what's going to work best for them. Then we will also screen those same women for the cervical cancer and treat that if necessary.
Lisanne? Oui. Bien.
US, we use a screening system called a pap smear to check for cervical cancer. In developing countries, that method is not always available. Luckily, there's another way for low resource settings to screen for cervical cancer. It's called VIA, visual inspection with acetic acid. Basically what happens is we get a visualization of the cervix and we use acetic acid, which is just plain white vinegar. That vinegar on the cervix will show any patches or precancerous lesions. From there, the provider can actually go ahead and treat these precancerous cells on the spot using a cryotherapy wand to freeze and eliminate the tissue. We can screen and treat in one visit, which is huge for the women who travel so far to see us. Another aspect of the Well Women in Northern Haiti program is that we're going to train a community health worker. Their only job will be to do public education about STI, how it's contracted, the family planning portions, the cervical cancer testing and treatment. They will just share information with the community at large.
I feel very pride and support the help MamaBaby has done for the area and especially its Haitian people.
Merci à MamaBaby parce que tu es entré dans Haïti pour un gros bagage pour faire mon ceinture. Je me dis merci pour tout l'autre monde qui a juste parlé. Son gros bagage, merci Seigneur pour cette grâce, ça grâce. Comme ça, je me dis merci au nom de tout le monde.